Hello, I'm Dr. Karthika, gynecologist from Vardhan Hospital. Today I'm going to give you some insight into the normal weight gain during pregnancy. Every pregnant woman should be aware of their body mass index. What is body mass index? It is nothing but weight in kg divided by square of height in meters. So everybody should know their weight in kilogram and their height in meters. So I have given the formula to calculate. It's a very simple mathematical formula. So everybody should calculate your BMI. So once you have calculated your BMI, so how to calculate the normal weight gain during pregnancy? For normal BMI women, the weight gain should be 11 to 16 kg. For example, if the BMI is more than 26, the weight gain should be less. In case if the BMI is less than 19, the weight gain should be more, that is 12 to 18 kg. In case if the BMI is coming in the higher category, that is beyond 26 to 30, the weight gain should be less, that is between 7 to 11 kg. If they are overweight, that is BMI is more than 30, they should gain appropriately up to 7 kg and not more than that. So let me explain how the weight gain occurs during pregnancy. So total duration of pregnancy is 9 months. During the 9 months period, first 3 months there will be more of vomiting and nausea, and patient will not be able to eat anything, and so the weight gain will not be there. Sometimes some patients will lose weight. From the next 6 months, that is from 4th month onwards, slowly they'll start to gain weight at the rate of 500 gram per week, that is maximum of 2 kg per week. So if you are going for a proper antenatal checkup, you just compare your weight gain for every month checkup. In case if you are gaining 3 kg or 4 kg in 1 month period, it is not safe. The reason is that too much of weight gain causes too much of complications. What are those is, if you eat too much and if you gain too much of weight, the excess fat will be deposited on you. There will be complications during delivery, and there is high chance for cesarean section. If you go for cesarean section, there is high chance for wound infection. And if you gain too much of weight through your nutrition before pregnancy, and there will be too much of effort you have to put to lose weight after delivery. Majority of the people will be coming to us like, I'm not losing weight, I'm breastfeeding, it's 1 year and now it's 2 years, but still whatever the weight I have gained, I'm not losing it. The reason is that it is the weight gain was too much during the pregnancy, so that they are finding it very difficult to lose it after delivery. Apart from nutrition, what are the other causes for excess weight gain? Not only the nutrition causes rapid weight gain. If you have preeclampsia, that is blood pressure, increased blood pressure during pregnancy, those mothers will be having some edema and swelling over the legs, and that causes weight gain. And if the mother is diabetic, called as gestational diabetes mellitus, those patients will also be gaining excess of weight because the baby's growth will also be very rapid, that causes excess weight gain during the pregnancy. So all these factors to be carefully checked for whether your nutrition is going excess, or your baby's growth is going in the higher side, or whether you are developing any pressure or sugar. All these things need to be checked when you are gaining excess weight. On the contrary, the other side is undernutrition. Some patients might not gain appropriate weight, that is not up to even 2 kg per month. For those patients, what we need to look into is a proper nutrition. Some patients from poor resource setting will be undernourished, or we have to check the baby's growth status. If the baby's growth is reduced, reflexly the weight gain of the mother will be reduced. So in either way, rapid weight gain and very slow weight gain, both the way is not good for mother and the baby, and you should gain appropriate weight as I have explained. In case if you would have gained too much of weight from during 4th month, 5th month or 6th month, one thing is you need to go for a careful checkup to check for any pressure or any sugar and baby's growth status. If everything is going fine, still your weight gain is excess, then you have to be careful on your diet. You should not eat too much, avoid excess sweets and sugars, and do moderate regular exercises for at least 30 minutes in a day. If you are in the undernutrition status, improve your diet should be adequate, nutritious, and well balanced.